About a week back, a very nice gentleman walked into my clinic, and unfortunately, he is diagnosed as hypertensive in the last year. And he asked me a question regarding his religious fast month, Ramadan, coming, that I want to fast, and I have never stopped fasting since the 7 years of age. And he was really eager to proceed with the fasting, but unfortunately I had to tell him that he is not fit to fast because his blood pressure was beyond 145 systolic. And he asked me a few more questions because he was willing to go for fast despite of the fact that I was requesting him not to. He asked me a few questions that what should I eat, how should I manage my medicine, and lastly, what are the symptoms of blood pressure that I should be looking for if I end up doing fasting. So this video is just meant to answer these questions so that at large, if ever anybody is planning to fast, he has some idea that what he should be expecting and what he should be doing. So the first question is, should I fast? Now that's a big question because it's religiously and emotionally, it's very close to people's heart when they want to fast. And even for the non-religious reasons, let's suppose if somebody wants to fast for intermittent fasting, for the weight loss and other health benefits, it's all good and fine, but you need to be cognizant of the fact that there is limitation to human body. So let's give it a number. So if a blood pressure is below 130 by 80 and generally well controlled with a single medicine, I think you can proceed with the fasting, but you must consult your physician. And that's a disclaimer for everything that I'm saying throughout this video, that you should discuss everything that you learn from this video with your physician and only then take some decision. This video is not meant to make you a medical doctor and a physician. It is just meant to educate you and answer a few of your questions. So on the other hand, let's suppose if your blood pressure is greater than 140 and less than 160 and you are on a couple of medicine, I would personally recommend that you should not fast. You should go ahead with your physician and manage your medication and blood pressure, lifestyle modifications. And if your blood pressure is greater than 160, despite of the fact that you are taking some medicine, I strongly suggest you should not fast. So let's suppose you decide to fast for some reason which is against the recommendation. Then the next logical question is, then what should you eat? The thing is, the first thing that is most famous is salt. You should and you must reduce the salt intake to the minimum to less than 1500 milligram in 24 hours. The larger the salt intake, the greater are the chances that you are going to have a hypertension or the blood pressure spike within that fasting period. And to add to that, if you are eating processed meat, that will also lead to a rise in blood pressure. Almost 12% of the patients who are having a processed meat intake with the fasting, they tend to have a hypertension spike. And the length of the fasting also has some role. Let's suppose this year, like in 2025, the fast will be around 14 hours in general in most of the countries. It depends on the different parts of the world, but generally, let's suppose in the subcontinent, it's around 14 hours. So 14 hours fast can have a blood sugar fluctuation of almost 20 degrees in different hours of fasting. So fasting can be used as a treatment of blood pressure if you are an overweight individual, you are a pre-diabetic and you want to reduce weight. But on the other hand, it can also lead to a rise in blood pressure if you are going against your doctor's recommendation. On the other hand, if you are not drinking properly and you are not taking enough of water in the early part, the sahar or the morning part when you start with the fast, in that case you are going to end up dehydrating yourself, and that may lead to a drop in blood pressure. But at the same time, if the body responds in a sympathetic drive manner, it will lead to a rise in blood pressure and associated irritability, frustration, and feelings like that. Then overconsumption of caffeine is also a risk, and it has been documented on some research in fasting individuals that the people who are taking more than 2 cups of coffee, ideally less than 2, like 1, but if they are taking 2 or more cups of coffee, there are chances that the blood pressure may fluctuate. So it's better to reduce the coffee consumption to less than 2 cups in 24 hours. The next thing is what is the medication like? This is beyond the scope of this video, that we should be targeting each and every medicine and how it should be taken, because it needs to be tailored by your physician to your needs. But in general, let's suppose if you are taking a lot of diuretics, the drugs that increase the urine output and take the water out of your body, take the salt out of your body, and they reduce the swelling and things like that. If you plan to fast, you must discuss it with your physician, cardiologist, nephrologist, whichever the case may be. The reason for that is, the less if you use diuretics in a manner that it is not sufficient for your needs, you will end up being short of breath in the middle of the day. On the other hand, if you take too much and then you don't drink anything for the next 14 hours, you may be ending up in dehydration state. So in either case, there is no one fit for all. There is nothing that I am recommending in this video. I am just asking and requesting you, if you are having a diuretic and you plan to fast, you must discuss it with your physician, the family physician, or whatever you can get your hands on. The next thing is, there are so many other drugs that are of different classes. Some of the drugs are not so good for the seher. They should be taken in the when you break the fast in the evening, called aftar, and that will help you to maintain the blood pressure, because some of the drugs, they tend to be a little stronger, and if you take them in the morning part when you are starting your fast, you may be having a hypertension episode in the middle of the day. The last question by that gentleman was, so what are the symptoms that I should be looking for? So answer to that is, there are 4 general symptoms. If you have a strong feeling of headache, that may be a sign of blood pressure. You must check your blood pressure. The other 2 signs are chest pressure or the pain and shortness of breath. And the 4th symptom can be fatigue. If you're feeling too much fatigue along with the shortness of breath and the kind of chest heaviness, that can be a sign of blood pressure being out of control. Always do check your blood pressure. Never go against the recommendation of your physician. If he or she is requesting you not to fast, I would request, just listen to him. Because I have seen things going the wrong way, and the people ending up in the emergency just because of the religious beliefs. And there is a lot of emotional inertia with the fasting, with the people of different religion. It's not just Muslims who are fasting. There are so many other religions who tend to fast. So it's a general statement for everybody. So stay strong, stay healthy, and don't forget to be the best version of yourself. Thank you so much for tuning in.